Everybody here is your friend or is here to help you. And if you keep that positive attitude, the better off you are.
Soon enough, you'll be back home and out in the community and facing life and seeing that there are lots of possibilities.
We're all survivors, and with that positive spirit, you will get back what you lost.
It's a good place to be. It really is, at the end of it all.
We're going to want them to certainly stick with the therapy. It takes time, and it is really like a full-time job. They need to stick with it and try to attend all their therapies, in spite of tiredness and fatigue, which sometimes seems overwhelming, I'm sure. And think of the long run, because you only really get to be on the rehab ward once, and you've got to give it a good shot while you're there.
It is the nursing staff who reinforce what all the other disciplines teach during the day. As one of the nurses said, "The rehab patients taught me how to be a good nurse."
The tertiary neuro rehab unit is a 45-bed unit, and it's basically a closed unit. And by that I mean the patients have to be assessed by the physiatrist when they're on the acute side of the hospital to come to our unit. The whole goal of our unit is to help you to learn and to encourage you to be independent again, dealing with your disability. The other people that will be involved are the whole interdisciplinary team, plus there will be porters, there will be spiritual care, there will be the Aboriginal liaison person, there will be home care, and of course all of your nurses and your caregivers that are on the unit. Our length of stay varies on this unit. You may be here for a week, you may be here for 2 months, and that again depends on your progress and what the team thinks about when you're ready to go home and when you're ready to be able to start coming in as an outpatient or moving on the continuum of care. Passes are encouraged on the rehabilitation unit, and the reason for that is to practice what you've been taught while you're in therapy here and what the nursing staff have taught you, so you can continue that at home and practice all those techniques, come back and tell us where you've run into problems. So I just want to reinforce again that rehab doesn't stop at discharge. When you're ready to go home, the team will decide and they'll discuss the date that you'll be going home, if you will be coming in for outpatient therapy, or if we have to look at alternate plans for you. But rehab does not stop at discharge, just so you know that. Every little gain is a positive for you and your family.
The physiatrist is the medical physician on the rehabilitation team once patients come to the rehabilitation unit. Physiatry is a medical specialty dealing with the rehabilitation of patients after a major neurologic or musculoskeletal problem. In their neurorehab unit, some of the common problems we will see is stroke, traumatic brain injury, or spinal cord injury. We particularly deal with a lot of common issues that arise after neurologic injuries, such as pain, muscle spasticity, bowel and bladder problems, or musculoskeletal complaints. And part of the process while patients are on the rehabilitation unit is often to gear them towards a transition home, and with that we often have multiple meetings as a multidisciplinary team working with patients and their families towards that goal. We follow both patients during their stay on the acute care units as well as their stay on inpatient rehabilitation units. We also continue to follow them as outpatients, often for many years after their neurologic event.
The key is they know what's in your best interest.
The Department of Nutrition and Food Services provide the menus, meals, and snacks in the hospital. Be sure you know the schedule for filling in the menus and returning them on time so your selections can be served. If you need help or extra time to complete the menu, arrangements can be made for this. Be sure to ask your nurse or dietitian if you have any questions or concerns.
Well, nutrition is as important as taking a medication, is as important as attending therapy, that a person eats enough food and drinks enough fluids. All right, so orange juice. So I'm involved mostly when people are not eating enough, there's poor intake for a variety of reasons, or a person is eating more than they need to, and if they have modified texture diets, and if they are on tube feeds. This one? Okay. It's important for patients when they're on a modified texture diet or a tube feed to be aware that it can be unsafe for them to be eating or drinking foods that aren't recommended. Food from home is fine, as long as it's the right texture and as long as it's within any of the medical limitations. And it's just important for patients to be aware that they haven't been forgotten, that we are watching how they're doing and making sure that we progress them as soon as they're ready. I try to make sure that there's a good understanding of the fact that good food choices are appropriate for everyone, and to try to minimize the amount of effort that's needed or seen to be needed in terms of providing an appropriate nutritious meal for the patient, and try to mesh that as closely as possible with what the family's already doing.
Give the doctors a chance to heal you properly, because we're all here for that reason.
So when people come to speech language therapy, I think sometimes they're a little confused about why they're there, because they may be thinking that they don't have a speech problem. And I guess I would like people to know that speech therapy is a little bit broader than that. We're looking at communication, not just the speech, but we're looking at reading, writing, your ability to comprehend what people are saying to you.
If a balloon is not going down, it's going up. Good. Awesome.
And we're also looking at your thinking skills and how they interact with language. So when people tell you a story, are you able to remember it? Or do you lose the details of it? When people are talking to you about a problem, do you have the ability to solve that problem, to come up with solutions?
If it's not dirty, it's
tidy.
Tidy. Good.
Yes.
Good. Good
Okay.
strategy. You chose a different word. Very nice.
The other thing that people may not know about speech therapy is that we are the main person right now that focuses on swallowing difficulties. And people having difficulty swallowing their food or liquids is very common after a stroke. We're there to try and help get you back onto a regular diet again and to do it safely. We also, if we're suspecting there's difficulty, that maybe some of the food or the liquid is going into the lungs, or there's a risk for choking, we may take you for an x-ray, where we can actually see where that food or liquid is going. We want the therapy to be personalized. We want it to be relevant to people's lives. We want to try and make sure that we try as much as possible to meet the patient and family needs in terms of what problem areas are a priority. What are the skills that we really, really want worked on right now? So for each patient, because the impairments, the difficulties after their injury are always going to be different, the therapy is meant to be custom fit. It's a personalized program set of goals with a lot of input from patient and family.
It's an all-inclusive environment. You know, family plays a key role in your recovery. The staff of the unit are there to help you along the way, and you know, they'll assist you wherever you need, they'll step back wherever you need, that kind of thing. They've got a lot of strategy that's useful.
Physiotherapy is the art and science underlying movement in function. On the rehabilitation unit, a physiotherapist will assess and provide an individualized program to achieve your specific needs.
Well, I think that a patient should know when they come to our rehab unit that they need to be involved. They're going to be involved in therapies throughout the day, usually up to 3 to 4 hours a day.
Yeah, you really want that, do you?
You know, if you're on your side, you can get up from here, not having to come back. Okay. You can start. We can start with that, Larry. Yeah.
And in physiotherapy, we really are working on a lot of mobility. And some of our patients may leave here and they still may not be completely independent in everything that they can be, but we try and maximize their mobility as much as possible to decrease the caregiver burden and hopefully get them as independent as possible. We have patients that come in that have been very independent in their lives, and this can be a huge change for these people. They are very dependent on others, and that can be very difficult for them. And it's very important to have the family involved as well, because oftentimes they're really involved. They're going to be there upon discharge to make sure that the whole plan goes well. So your rehab stay is not the end of your rehab. It's not the end of your recovery process. You're going to be continuing to improve even beyond your rehab stay. But when you leave here, we know that you have the support set up and you're independent to be out in the community. And you no longer need to be an inpatient in the hospital.
No matter how hard you push, your body heals in only one speed. So just be thankful for whatever step you make.
Occupational therapists promote independence in everyday activities. They focus on everything from dressing and cooking to being able to function again at home and at work.
Overall, we look at one's ability to increase their independence to enable them to go back to those daily life roles prior to coming into the hospital.
Okay, let's slide up. Let's go up high, and just stretch your arm a little bit here. Okay, right there. Okay, and just bring your body back. That's all right.
So the plan of treatment is individualized to work towards the things and the gains that they want to make again. Everybody's different and everybody has different goals that they're working on. So, we really focus on per client and their goals and what they want to achieve, and looking at the strides they have made rather than comparing them to other clients on the floor.
Now you could cover it a little bit higher. Because if
we also encourage clients, to go out into the community is a big important part. So the skills they're learning inside this environment, that they get a chance to go out with their families or other members and use them in the community. So they get to try, all the skills they're learning here in the real world. And then that really helps us know, and them, to have successful experiences and to know they can manage a lot of life roles again.
And if they tell you to do something, do it. No matter how hard it is, do it. It's for your best interest and it pays off in the long run.
Recreation therapists play an important role in your rehabilitation by helping you to learn new ways of participating in leisure activities that you enjoyed prior to your hospital admission. They will introduce and teach you new leisure activities for a healthy leisure lifestyle. Recreational therapists will also help you learn about what is available in the community and how to access these social and recreational programs when you leave the hospital.
In recreation therapy, we focus on a few things. The first one being the development of leisure skills. The second one is that when somebody's in the hospital, they do have blocks of time, and in recreation therapy, we can help them use that time in a productive way. The third thing that we focus strongly on is that which we call community reentry or community integration. And we do that by suggesting activities that people can do out in the community once they've been discharged home. So the recreation therapist, her primary role would be to assist somebody in introducing them to that idea, as well as actually facilitating them to attend a program that's available in the community that would assist them in developing or relearning that skill again. We do that with a multitude of kind of activities. Skiing is one of them, golf, swimming, whatever you can imagine. Usually in Calgary and in the rural areas as well, we've got good contacts that allow us to integrate that person back into that activity that they wish to pursue for their future. The other area that we may focus on is from a financial perspective. If there are some money issues happening at home, we can also look for programs that are a low fee cost, or in some cases no cost at all, with some backup from the therapists in terms of the relevance or the need for that program in the community.
It's all manageable. You just have to find different ways. Sometimes it's frustrating, lots of times it's very maddening, but you still get to do what a lot of other people can do.
Psychology provides help with evaluating strengths and weaknesses in thinking. They are also there to provide strategies to help with stress and life changes.
Well, we know that patients don't come to neurorehab chomping at the bit to see a psychologist, but our patients are facing extraordinary circumstances and stress and changes, and we are here to help them work with that. For a lot of people, they have to be able to also have their time when they take off their brave face and they can express what it is that they're really feeling. Those kinds of thoughts and feelings that they have in the middle of the night. We know that it's not just the patient that's going through these stressors, it's family members as well. Making that transition to life outside the hospital has its challenges too, and we like to be available to the patients and family members to help them to make that transition as smoothly as possible and to deal with those challenges as they come up.
I got frustrated, you betcha. There's days that you get very frustrated, but you don't give up.
Social workers help patients and family to navigate through all the financial and insurance forms. They are there to advocate, to support, and to teach. They begin your discharge plan very early so that you're ready to go when the time arrives.
I think when a patient comes to the neurorehab unit, they need to know that for a little while, social work's going to be their new best friend.
Couldn't stop crying. I'm like, oh. I sat there for a few minutes, people going by, and I think it's so important to communicate.
We are there to coordinate an awful lot of details that can be quite a headache for the patient and the family, helping with finances, helping with equipment and contacting resources. We start it right away when they come so that whenever it's time for them to get home, everything is in place. We do a lot of adjustment because it's the whole family needs some help coping. We have support groups, and success is adjusting so that your life is not a mess. That you carry on and take your life back. That's success.
Well, the one thing that we like to remind people is that each of the therapies has their own program, and yet the single goal is to try to do all the little things that add up to enhancing the healing that Mother Nature can allow. And of course, there may be limits to that, and we can't always predict how much healing or recovery somebody will have, whether it's a stroke or other injury. but each part of therapy has a goal to sort of enhancing that recovery. And so if people sort of understand that and try to cooperate as much as they can with each of the therapists, I think, you know, their progress will be at least enhanced as much as it can be.
Got to have the right attitude, or it's just going to make twice as hard for you.
It's a great place to be. Sometimes it doesn't seem so, but they're all there to help you and get you better and get you back on your feet, so to speak. So,
The more you put into your recovery, the more you will get out.
But as time goes on and as experiences, you know, accrue, you realize that there's still lots of things that you can do out there.
No matter how tough things got here, we had some good times. I had some good times, you know, some good laughs and stuff like that. We had some good times, didn't we?